Hello viewers, this is Gaston from the Healthcare Engineering team. Welcome to our part 2 radiation therapy video. In this video, we are going to cover up the last parts from the video 1. We would like to request our viewers to subscribe and share our YouTube channel to show us your huge support. In future, with your support, we will provide several other informative and novelty videos like this. Let's watch the video. Now let's think about radiation biology. When people are exposed to ionizing radiation from sources outside or inside the body, the radiation may interact with molecules and cells in their path. Some ionizing radiation can travel through a few or several layers of cells, beta particles radiation, or through many cells layers into and through tissues deep within the body, X-ray and gamma radiation, whereas alpha particle radiation has short paths or tracks. What do we mean by radiation therapy or radiotherapy? Radiation is one of the most common treatments for cancer. Other names for radiation treatments are radiation therapy, radiotherapy, radiation and X-ray therapy. Radiation therapy uses high energy particles or waves such as X-rays, gamma rays, electron beam or protons to destroy or damage cancer cells. Cells normally grow and divide to form new cells, but cancer cells grow and divide faster than most normal cells. Radiation works by making small breaks in the DNA inside cells. These breaks keep cancer cells from growing and dividing and causes them to die. Nearby normal cells can also be affected by radiation, but most recover and go back to working the way they should. While chemotherapy and other treatments that are taken by mouth or injection usually expose the whole body to cancer-fighting drugs, radiation therapy is usually a local treatment. This means it's usually aimed at and affects only the part of the body needing treatment. Radiation treatments are planned so that they damage cancer cells with as little harm as possible to nearby healthy cells. Radiotherapy can be suggested for two different purposes. First one is palliative care. This care that affords relief but not cure. Second one is curative care, which is on the other hand is defined as care that tends to overcome disease and promote recovery. Let's think about the goals of radiation therapy. To cure or shrink early stage cancer. To stop cancer from coming back, means recurring somewhere else. To treat symptoms caused by advanced cancer. To treat cancer that has returned. After that, let's talk about some side effects of radiotherapy. Sore or red skin, feeling tired most of the time, hair loss in the area being treated, feeling sick, losing your appetite, a sore mouth, diarrhea are some few effects. Now let's think about how does the radiotherapy work. Radiation therapy can be given in three ways. First one is external radiation or external beam radiation. A beam of radiation is directed into the body. This may also be called X-ray therapy. 3D conformal radiation, intensity modulated radiation therapy, cobalt, photon or photon therapy. External beam radiation therapy is usually conducted using a linear accelerator, a machine that directs high energy beams of radiation into your body. Second one is internal radiation. A source of radioactivity is placed inside the body, near the tumor. This is called brachytherapy or implant therapy. The third one is known as systemic radiation. Radioactive drugs given by mouth or put into a vein are used to treat certain types of cancer. These drugs then travel throughout the body. The units, the absorbed dose of radiation are measured in the scale of Gray. The symbol is GY, that's the international standard. This measurement is measured by dosimeter. Dosimeter is the process of determining the effective dose received by persons exposed to ionizing radiation. The most accurate way to determine dose to an individual is to make measurements with a dosimeter assigned to each person. That is required to do for radiation workers that might be exposed during a routine occupational activity. Area monitors measured external radiation or radioactivity suspended in the air at specific locations. No dosimeter can directly measure the dose to the lung from the inhalation of radioactive materials. So area monitors are the principal instruments used for measuring and controlling internal exposure in underground mines. Finally, thank you so much for watching our video. Please support us by subscribe and share our YouTube channel videos. In future, we will bring many more informative videos like this. Again, we are very active in the above mentioned social media platforms. Please follow us to get our latest news. If you would like to approach us, please drop an email to the mentioned email address. Kindly visit our website www.learnbiomedengine.blogspot.com to know more on this concept as well as several other concepts related to healthcare. Thank you. Have a nice day.